The 6-minute walk test involves a patient walking between two cones set 30 metres apart on a clear corridor. Instructions are standardised to the patient, so if the test is re-carried out in a few months' time, the instructions are the same. These include that the aim of the test is to walk as far as possible for 6 minutes, but don't run or jog. It's a long time and you will be exerting yourself, so you're permitted to slow down or stop and to rest as necessary, but the timer will continue. I will let you know as each minute goes past, and then at 6 minutes, I will ask you to stop where you are. After the test, a marker is placed where the patient stops. A chair as well as oxygen will be available in case of an emergency or if a patient needs a rest. The patient's SATs are measured before and after the test. Sometimes it is measured throughout. The patient addresses their breathlessness based on the Borg breathlessness scale.
Contraindications for the 6-minute walk test includes unstable angina and myocardial infarction within the last month. The relative contraindications include a heart rate of above 120 beats per minute, a systolic blood pressure of 180, and a diastolic blood pressure of 100. If your patient presents with any of these symptoms prior to the test, they should be referred back to their physician, and a clinical assessment should be done about whether or not a test like this is appropriate. Pulse oximetry should be used to measure baseline heart rate and oxygen saturation levels. Have the patient sitting in a chair for at least 10 minutes prior to the test and use the modified Borg scale to measure their baseline breathlessness. These vital signs such as heart rate, breathlessness, blood pressure, and oxygen saturation levels should be measured pre and post test, while breathlessness and oxygen saturation levels should be measured every minute.
Hi, my name is Saoirse and I'm going to be finishing off our Learn resource talking about how to interpret the 6-minute walk test in COPD patients. So all the references and all the papers that I'm referring to in this sequence, they will all be linked at the end. We've all mentioned them in our presentations if you want to look into them. So we found this very interesting because there was a couple articles that talked about the total distance the patient would have to achieve. So one of them was if the patient does not reach over 250 meters in the 6 minutes, this can lead to mortality in the next year. And also if a patient had declined by 50 meters following a subsequent 6-minute walk test, that this could lead to severe deterioration in over a year. So this is very, very important for a physiotherapist to understand, because that baseline can show that your treatment plan is not working and they will need to have it adapt and suited towards them. So this is when we can actually look at the results of the 6-minute walk test and realize this patient is getting severely ill and this could be towards the end of their life, or this is a window where they're beginning to plateau or they're beginning to deteriorate, and this is when we are supposed to step in and adapt the program to them and make it more functional and help them in the way that we didn't before. The most important information that we gathered from the whole presentation and research was the MDC and MCID, which is the minimal detectable change, which is important for the physiotherapist to know. And in relation to the COPD patients, this is 54 meters, and also the MCID, which is the minimally clinically important difference, which is important to the patient, is also 54 meters. So this is very handy because if there is an improvement of 54 meters or above, we can see that yes, there is a change in their functional and their muscles, and that we know that our program is actually working for the patient. But that 54 meters, if they're above it, it's actually very functional and it's improving the quality of life for the patient, which is very important to note. So to finish up, we now know how to interpret the 6-minute walk test, and this is by the marker 54 meters, that this will have a big effect on the patient's life, and that also it's working very functionally and physically for the patients, that they're improving. We now know that if they drop below 250 meters, that this is very concerning, and if they have a deterioration of 50 meters. So now we know how to perform the test and what to do during the test, and now we know how to interpret it. I hope you've learned lots, and thank you very much.